The third trimester of pregnancy starts in week 28 of your pregnancy and lasts until you give birth, which is around the 40th week. The third trimester can be tiring and more uncomfortable as your baby takes up more room and you experience the following. Backaches. Pregnancy hormones relax the connective tissue that holds your bones in place, especially in the pelvic area. These changes can cause backaches and other discomfort during the third trimester. When you sit, choose chairs with good back support. Get regular exercise. Wear flat or low-heeled shoes with good arch support. Shortness of breath. You might get winded easily. Good posture will give your lungs more room to expand. Heartburn. Pregnancy hormones relaxing the valve between your stomach and esophagus can allow stomach acid to reflux into your esophagus, causing heartburn. To prevent heartburn, eat small, frequent meals and avoid fried foods, citrus fruits, chocolate, and spicy or fried foods. Spider veins, varicose veins and hemorrhoids. Increased blood circulation might cause tiny red purplish veins, spider veins, to appear on your face, neck and arms. You might also experience swollen veins, varicose veins, on your legs, and hemorrhoids. To ease swelling, exercise and elevate your legs frequently, include plenty of fiber in your diet and drink lots of fluids. For hemorrhoid relief, soak in a warm tub or apply witch hazel pads to the area. Frequent urination. As your baby moves deeper into your pelvis, you'll feel more pressure on your bladder and the need to urinate more often. This extra pressure might also cause you to leak urine when you laugh, cough, sneeze, bend or lift. If this is a problem, consider using panty liners. Hey, so tell us how you are managing your third trimester in the comments section below. And thanks for watching Tiny Tribe Parents. If you enjoyed this video, please click the like button, comment and subscribe to our channel for more incredible content that is on the way.